there has to be a better way for them to test your lymph nodes. I'm having, the hardest thing I'm struggling with is my lymphedema. And it just seems like to remove them is just so devastating for a lot of people.
Lymphedema is caused by a disruption of the lymphatic vessels. The lymphatics are little tiny tubes, they're almost like veins, but instead of having blood go through them, they have lymphatic fluid go through them. It's a different type of system. You know, your arteries and veins have blood and your heart pumps it. The lymphatics, there's nothing really to pump in that way except for movement. So when you move your muscles and move around, it actually moves the fluid from the periphery, your fingers and everything, all the way back to the center. When people have cancer, frequently lymph nodes are removed because cancers can spread via the lymph nodes. And they take out lymph nodes to help diagnose, to see how far the cancer is spread, sometimes also to help treat the cancer, to help prevent it from spreading further. In doing so, you can disrupt those lymphatics, and then the lymph doesn't flow, and then it can build up in certain areas. So lymphedema is edema, which is fluid swelling caused by lymphatic fluid, which is caused by a disruption of the lymphatics, the vessels of the lymph system. There's no perfect cure for lymphedema. There are therapies for lymphedema. The lymphatic massage does help. It can help squeeze a lot of this lymphatic fluid that's kind of trapped in the limb back into the rest of the body. There are some newer techniques that seem to have some promise, but definitely are not home runs, meaning we can try to repair some of those vessels, the lymphatics. Again, very difficult to do. They're extremely small. When we're talking about lymphedema caused by breast cancer or mastectomy and actually a lymph node dissection, meaning removal of the lymph nodes from under the arm, using your own tissue to reconstruct the breast does seem to help some. Many of my patients with lymphedema, after I've reconstructed them with a flap, DIEP specifically, their lymphedema seems to improve by maybe about 50% or so. It's not a cure, but it does seem to help. There's some evidence that fat grafting and release of scar tissue in the axilla may also help, but right now all this stuff is very preliminary, it's very early on.